Hey girl, hey, it's your birth bestie, Nurse Rini, and I am back with another video. I know I've been gone for a while, forgive me, but we are about to dive into some things. So let's dive in. So in this video, we are going to talk about epidurals, and this video is going to be a little different because we're also going to use a Reddit story to talk more about epidurals and how they work and listen to some of the things that are being said in this Reddit story. I think it's a great example of how you have to do your own research, but also look for someone who doesn't give biased information, such as myself. And the reason I say I don't give biased information is because I don't know you and you don't know me. And you can trust that I just want you to have a well-informed and a safe, healthy, and happy experience rather than trying to sway you one way or the other. So that's why I just come to you with the information, no judgment zones, a safe space. And yeah, so I'm just gonna give it to you straight, no chaser. Now let's dive in about epidurals. So as you can see, our objectives are as follows. We're gonna review this Reddit story that's entitled Epidural Myth. We are going to talk about some of the valid points within that story. We are going to talk about the benefits of an epidural. And we're going to talk about potential downsides because everything isn't all gravy on one side versus the other. Everything has its benefits and some, risks. So we're going to talk about those. We are going to talk about my thoughts about this as an obstetric nurse, as a nurse who has worked in high-risk labor and delivery, antepartum, and postpartum. I'm going to tell you my thoughts, just in case you were wondering. And lastly, I'm going to talk about what you should do. So let's dive in. Let's dive into the story by This Kangaroo 2086 called Epidural Myth. I'm annoyed. I went to a weekend intensive birth class with my partner run by a certified nurse midwife. Takeaways: don't get an epidural unless you really can't cope. Push it to the last minute, which is what I totally do not recommend. But why? It slows down contractions. I go back and report this to my friend, who is a mother of 3 and a practicing anesthesiologist who administers epidurals for a living. She was fuming. Not more of this stupid BS, she said. She was mad. She said, get the epidural early, as soon as you can. It takes away the pain and stress, might allow you to sleep and gather strength. She said this stupid story pushed out by midwives results in countless women being so exhausted by pain at the end of the labor that they need a C-section, which is much, much worse. She herself went to birth classes and argued with the midwife, whose only reason was, oh, you should try the natural way because nature is better. As my friend said, BS, we have modern medicine and women don't need to be in pain. So this is an announcement for anyone who has been misinformed. Google it for yourself. The research shows the labor might be slowed down by 15 to 20 minutes if you have an epidural, which is nothing compared to 20 plus hours of pain, if you ask me. What a travesty. We are being misinformed and told to handle pain. Nothing new. Us women have had hundreds of years of this. Edit. I'm in Germany. Docs, midwives, and anesthesiologists get paid the same set wage no matter how many patients they see or meds they dispense. So that was her disclaimer. So let's dive into it. I do think the travesty is that she was misinformed, but I also think the travesty is that she went to a childbirth education. So she took that extra step to make sure she was being well informed and getting reputable information, and she got misled because someone had personal gains. But this is why I'm here, girls. So we're going to talk about all of the things. So let's talk about some of the valid points of this story. Her friend, who is an anesthesiologist and sounds like she's an OB or obstetric anesthesiologist, said that this is some BS. Valid point. It's BS. Yes, it slows down your labor a little bit, and actually, I don't think it slows down your labor. I think it slows down the second stage of labor, which is the pushing part. And that's until you get your bearings straight and you figure out where to direct your pushing efforts. But again, it's by 15 to 20 minutes. And if you are super duper uncomfortable, what's an extra 15, 20 minutes of painless labor? I don't know. It may matter to some, it may not matter to others. But in this case, you don't have to be making a decision based on misinformation. The second point would be getting the epidural early. I think this can go either way. I think it's really up to moms when they decide to get an epidural. If you want to feel zero pain, get the epidural early. I would say if you are exhausted and you want to rest, I would not wait until you're like 8, 9 centimeters to get the epidural because you probably won't have time to rest after that. It'll probably be closer to pushing time than actually rest time. So I would say once you start to feel uncomfortable and you don't want to feel more uncomfortable than that, then that's pretty much the time I always tell my patients to get the epidural. If you are contracting, right, if you're in labor and they want to kind of ramp up your labor by breaking your water, get your epidural first if you intend to get one, because once they break your water, the contractions are going to ratchet up, and that's what it's intended to do by breaking your water. So definitely, if you plan to get an epidural and you're contracting in labor, you have a good pattern and they want to break your water, get the epidural first. You heard it here. Leave a comment below if you've experienced them breaking your water and sending you into full-blown labor and it was totally unexpected. Let me know in the comments. It helps with rest. So this anesthesiologist said it helps you rest. And it does. It really does, because it takes away that discomfort that's keeping you awake, and it lets your body, release and relax. And so you can often see moms who are tense because they're uncomfortable get the epidural, relax, and dilate, because the uterus is a muscle. So if you are tensing your body, then your uterus is also going to be tense and it won't be able to work as effectively. So again, I've seen plenty of mothers get the epidural, get in bed, and then just start to dilate because they don't have that tension and that fear around having that pain. It removes pain and stress. Again, same thing. If you don't handle pain well, this is no judgment. I think there's not many pains that are like childbirth. I've heard kidney stones are pretty bad. My mom says she would rather have a baby than have a kidney stone. But yeah, childbirth is pretty different, right? And so oftentimes you are uncomfortable in different ways that people really can't understand. And it can stress you out because you're anticipating another wave of contractions. So if you are anxious due to the pain and the discomfort, then it will hopefully likely allow you to rest and relax and get some sleep. It helps you gain strength, right? Because you're resting. And so your body is in recovery mode while you're resting. And that gears you up and gives you that energy and that strength that you'll need to push, because pushing is a whole other animal. Some patients need to have a C-section due to maternal exhaustion. This is what the anesthesiologist in his Reddit story said, and it is true. If moms are so exhausted that they cannot continue pushing, then the doctors really don't have much of an option other than taking you back for a C-section if it's really that time to deliver your baby. Because what we don't want is you to be in the middle of pushing and you're exhausted and you just can't push anymore and the baby gets wedged in the pelvis, or you deliver the head and experience a shoulder dystocia because you don't have the energy to punch behind that contraction and push through with another one to deliver the body. So sometimes that can happen. And it's modern medicine. Yes, there's not much else people would tell you to suffer through as far as pain goes. Like, no one expects, anyone to do anything without being medicated and being comfortable. So I personally don't look at childbirth any other way. It is something that you can, experience without pain, then why not? Or with minimal pain. Definitely it's an advancement in medicine. I mean, if you think about how far we've come, they used to knock women out and gas them, and you wake up and like, here's your baby. But we've come a long way. And part of that progression too can be looked at as getting an epidural and the benefits of that. So let's talk about some of the benefits of an epidural. It allows you to rest. We talked about that. It allows the uterus to relax. Again, that tension leaves your body when you're comfortable, and then you can dilate effectively. You can have painless cervical exams. When you are pregnant and before you have your first baby, oftentimes your cervix is way in the back of the vaginal cavity, right? And so the doctors have to go really deep because it's posterior. They have to go really deep. They're like, I always say, digging for gold, trying to find your cervix. And so as it dilates and effaces, it does start to move to the front a little more anterior. But until then, they have to go digging pretty deep to get to your cervix. And if those cervical exams are uncomfortable for you, then getting an epidural is going to be a lifesaver, and it'll make you feel so much more comfortable. In this case, if you are very sensitive to cervical exams, I would definitely say getting an epidural earlier is going to be the best mode of action. You can be awake for an unscheduled C-section. And I think this is like the beauty of an epidural overall. If you are a labor patient, means you're in contracting and you're expecting to have a vaginal delivery, but things change course for whatever reason and you end up having to have a C-section, you already have pain management on board. You can be awake during the C-section. You can be awake when your baby is born, and you can be awake to meet and greet your baby. And this also goes for like a stat C-section or emergency C-section. If you do not have an epidural and your baby drops their heart rate pretty low and they have to rush you to the operating room for an emergency C-section, then they will put you to sleep, right? You won't know what's going on or anything like that, which is fine. I mean, they'll wake you up and you'll recover. But if you have that epidural already, then it's great because they don't have to put you to sleep. They can just dose your epidural and you won't feel pain during the C-section. It's temporary, right? It's a temporary method of pain relief. It doesn't last. It's not going to like ruin the experience for you. It's a temporary relief from the experience that you may have otherwise had. It decreases your pain. It may not take away your pain completely, but a significant decrease is always better than none at all. And actually with epidurals, we look for you to be fairly comfortable, but you may not necessarily be zero pain. If you are, great for you. We love it for you, but it's not always guaranteed to be no pain. You can get it anytime. I think this is one of the best things about the epidural. If you can keep still, then you can get an epidural. This is the common question I always get. When can I get an epidural? Rainy, when can I get an epidural? And I'm like, anytime you want. I have had patients come and say, I don't want to feel anything. I want my epidural before we start the induction process. Okay. So, it's really up to you. I've had a patient whose birth plan was to get an epidural. She came in completely dilated, locked her ankles and said, I will not push until I get my epidural. And literally it was one of those situations where, it takes a little bit of time to get an epidural. And we talk about this in the paid course, like when the best time is to get an epidural and all the things that go into getting one. But it can take some time to get an epidural. And I think in her case, the anesthesiologist was in the operating room. So she was going to have to wait, right? And, by the time the procedure, the ceremony of like making a sterile field and inserting it and dosing it to make sure you get the pain relief, she could have had the baby, but her plan was to get one. So literally you can get one anytime. I always tell my families and my mamas especially, you have to be able to sit still through the contraction to get the epidural. So that's why I always say, don't wait until the 11th hour to get one, because you want to be, yes, uncomfortable to know that you want it, but not too uncomfortable where you won't be able to sit still for it. Make sense? So of course, with anything, there are downsides, and there are more downsides that I didn't list here, and there are more upsides that I didn't list on the other slide. However, some of the downsides could be that you don't feel your legs, and that can be really weird for some people. I've only ever had one patient completely freak out over that, and we had to just kind of bump down the dose as well as let it wear down. And that's okay. But that was one person in all my years of working in OB. But it can be a little weird, I imagine, to not be able to feel your legs. You also may not feel the urge to push. And that's where that delay can come in, that 15 to 20 minute delay. But a lot of that is with your nurse and your provider or your midwife. So they will let you know whether or not your pushes are effective and try to redirect you so that you are pushing effectively so that we can get your baby delivered. And I've also had instances where, okay, she's super numb, she can't feel anything, let's cut the epidural off, because it doesn't wear off like that. It does take time to wear down, and as it takes time to wear down, you're still comfortable, but you start to get feeling back. So I've seen that as well. Again, pushing ineffectively, you may get a spinal headache. It is a potential downside side effect of an epidural, and we talk more about that in our paid course, but it's infrequent that it happens, but there is an easy fix for it, so just keep that in mind. One of the downsides is that it can take an hour and a half to 2 hours to wear off, but that's okay if you're being relieved of discomfort that would have gone on for hours and hours, I would think. So, but it does not wear off right away, and you have to kind of find your legs again afterwards, to feel like noodles. But your nurse is going to be there with you to help you navigate and, get your feet back and start to walk again. One of the downsides is that you may feel pain relief, like contraction pain relief, but the epidural does not guarantee pain relief from feeling pelvic pressure. And unfortunately, pelvic pressure can be intense to the point where people my epidural wore off, and we're like, no, it didn't wear off. It just doesn't always cover those nerve endings down there. So you may feel a significant amount of discomfort, which is pelvic pressure or rectal pressure when it's time to have your baby. Some of the other downsides, I think, is sitting in the correct position for the epidural, which you see in this slide here. But you have to be able to maintain that position until the procedure is complete, even through contractions. So just keep that in mind, ladies. You have to get to a very specific position for the anesthesiologist to be able to put it in well and for it to work efficiently, and so that it doesn't cause any kind of harm to you. So you have to be able to keep still, or the anesthesiologist will not do it. What are my thoughts as a registered nurse who's worked in this field for a long time? What do I think? Do you, boo-boo. Do what works for you. I'm extremely aware of the pregnancy wars, the labor and delivery wars that are going on in these maternal pregnancy prenatal streets. And I think that if you feel like you're being judged for what you want to do, or you may be judged for what you want to do, then don't talk about it. Just say, I'm not sure, I don't know, we'll just kind of see, play it by ear, whatever, yada, yada, yada. Don't let anyone make you feel any type of way about it. There's so many things that can influence how you experience labor. So just because Becky had an unmedicated birth doesn't mean that that's what's going to work for you, because Becky's baby was probably 6 pounds, 8 ounces, right? And head down, face down, and slid on out. Your baby may be 9 pounds, and it may be what we call asynclitic, right? So it's kind of turned in this weird, type of way trying to come out the pelvis, it just may not be optimal, or it may be looking up. The baby may be looking up, which is notoriously way more uncomfortable for a lot of mamas. So, just block people out. Don't even discuss it if you feel like a way, like, you might get judged about it. But anyway, so again, do what works for you. That's my thought as a registered nurse. And if you don't know now what you want to do, I think that's okay. As I mentioned, you can get your epidural pretty much anytime, with some caveats in there that we go into in my paid course. But yeah, do what works for you. No one is judging you, especially not in a hospital. But again, things that can impact how you experience labor and whether or not you may be in need of an epidural would be the baby's size or their weight, their position. Are you a super small pelvic person, but your baby's nice and robust and rotund? Are you delivering a baby watermelon and you have very narrow hips? Whether or not an epidural is a viable option, you have to find out. Some women have issues where they cannot get an epidural. It could be a spinal issue. It could be, other things, blood issues and things like that as far as platelets go. But I have seen moms who maybe, and I don't think this is very common, so, it's something you can inquire about, but they can put in an epidural line and not put medication through it and use it in case you need to go to the OR. I've seen that done like once or twice. I don't think people like to do it because it's an invasive procedure. And if you're not going to actually use the benefits of it, they don't want to put it in on a maybe. Maybe you'll use it, maybe you won't. But I have seen that done where they put the line in and then they, just let it hang out. And if you need it to go to the OR, they'll do that. So the reason they'll do this is if mom absolutely wants to go unmedicated, but her baby is showing signs of potential distress, they may be like, I highly recommend an epidural in case we have to rush you to the OR. Because sometimes we can anticipate that your baby will need to go to the OR. So what do I think that you should do? I think you need to talk to your doctor about your options. This is a person that is professional. You've hired them. They kind of work for you, right? And they are very familiar with the environment, the atmosphere, and everything that goes into epidurals and labor with epidurals and without. Talk to your provider about it. I think that's a good place to start. And I always recommend speaking with the anesthesiologist that is present in the hospital when you get there. They can assuage any fears or concerns. You can ask questions of all sorts. It helps you kind of know what you can anticipate and who's actually going to be performing the procedure. That may help you decide as well. I am a clinical nurse instructor, as you may know, and I had a student who has a 15-month-old, and she had an unmedicated vaginal birth, but we were able to let her see an epidural placement in a labor patient. And she said to me, I didn't know that they give you numbing medication before they put it in. And I was like, really? I was like, that's very interesting, because he just knew she was going to go unmedicated, which worked for her. But that is interesting that she is an experienced mom now, has gone through labor, and she didn't know that. So this is something, one, that I want you guys to know, that you do get numbing medication before they give you the epidural. But also, there's more to things than we initially realized. So I think it's really great to speak with the anesthesiologist. Keep an open mind and be flexible. Give yourself grace. You can get it or you don't have to get it. There's no pressure either way, but give yourself grace and give yourself the option to change your mind. And that's, I think, the biggest key to a successful childbirth experience is being flexible with yourself and having an open mind. At the end of the day, you need to do what works best for you and your family. So I hope this was helpful. Let me know in the comments if you plan to get an epidural, if you're undecided, if you plan to absolutely not get an epidural, if you've had a baby and you got an epidural before, but you want to go unmedicated this time, or you went unmedicated the first time and now you want to try it with an epidural. Let us know what you think and what you want to do, and some of the other wild things that you may have heard about epidurals in the comments. And if you find this information very valuable, I hope that you follow me, like, comment, and share. And also just stay tuned for more videos and look at the other videos on the channel, because my goal is to inform, educate, and subsequently empower you guys to have an exceptional birthing experience. So bye.